Good evening, and before we dive into this new study, I wanted to quickly mention that today I published an exclusive interview between myself and Dr. Richard Urso over on Epoch TV. In this interview, we discussed many topics, such as how physicians are essentially getting handcuffed by government regulations, as well as what might potentially be behind the 40% increase in all-cause deaths among prime-aged Americans. If you want to check out that awesome interview, it'll be over on Epoch TV. I'll throw a link to it. It'll be down in the description box below. And now, let's move on over and discuss some new research. According to a new study that was published by researchers over at the Seattle Children's Hospital, they found that heart abnormalities were detected in some adolescents several months after receiving the COVID vaccine. Specifically, these researchers were reviewing the cases of children who came into their hospital within a week of getting their second dose of the Pfizer vaccine. And even more specifically, they were looking at the cases of these fully vaccinated children who were experiencing chest pain as well as elevated serum troponin levels. These are two key markers of heart inflammation. And after identifying the children who fit this very narrow criteria, meaning that these fully vaccinated kids had experienced heart inflammation after getting their second dose, the researchers followed up with the kids in order to see how their hearts were doing several months after getting the shot. And so the researchers found these kids, they conducted cardiac imaging on them, and they found that 69% of the children that they were testing had persistent LGE, which is late gadolinium enhancement. It's a type of heart abnormality. Although the researchers did note that this level of abnormality was actually lower than in prior months, meaning that according to their findings, this particular heart abnormality persists for several months after vaccination, but generally it does appear to get better over time. However, the cardiac imaging that these researchers conducted also revealed that 3/4 of these patients, meaning 3/4 of these fully vaccinated children, also had something known as abnormal GLS, which is global longitudinal strain. It's a measurement of heart function. Here's specifically what the researchers wrote as a part of their findings, quote, "A previous study found that in a cohort of 18 patients with myocarditis, nearly 70% had persistent cardiac imaging changes at a median follow-up time of 7 months. Notably, in our cohort, though there was significant reduction in late gadolinium enhancement, which is abbreviated as LGE, at follow-up, abnormal strain persisted for the majority of patients at follow-up, meaning that between 3 to 8 months after becoming fully vaccinated, the majority of these particular children were experiencing abnormal strain to their hearts." The researchers then went on to write this, quote, "In a cohort of adolescents with COVID-19 mRNA vaccine-related myopericarditis, a large portion have persistent LGE abnormalities, raising concerns for potential longer-term effects." However, the researchers also noted that despite these persistent abnormalities, quote, "all patients had rapid clinical improvement and normalization of echocardiographic measures of systolic function." Meaning in plain English that despite these children having long-term abnormalities, it appears that their systolic function, how well their heart pumps, does get better over time. However, these researchers noted that these risks, they apply more specifically to young boys as well as adolescent men. Here's specifically what they wrote on this front, quote, "The CDC notes that even though the absolute risk for myopericarditis following mRNA COVID-19 vaccine is small, the relative risk is higher for particular groups, including males 12 to 39 years of age. Further follow-up assessment and larger multi-center studies are needed to determine the ultimate clinical significance of persistent CMR abnormalities in patients with post-COVID-19 vaccine myopericarditis." Which is all well and good. I mean, of course, more testing is good, but frankly, I would assume that many parents would hope that these studies were conducted prior to their kids having gotten the shot. Regardless, though, what the researchers mentioned in this particular study, that the risk is especially acute for males between the ages of 12 to 39, well, that is technically true. However, the real danger seems to be for young men between the ages of 12 to 17. In fact, several weeks ago, the CDC themselves came out with an analysis of the vaccine side effects, and they concluded that not only was heart inflammation higher than expected in multiple age groups and was particularly pronounced for young men, but also they concluded that the real number is very likely significantly higher since cases are underreported. Specifically, these researchers with the CDC, they analyzed the data within the VAERS system, which tracks adverse reactions to the vaccine, and they concluded that between December of 2020 and August of 2021, young males between the ages of 12 to 17 were the most likely to suffer post-vaccination myocarditis. In fact, according to the study that these researchers wound up publishing in the Journal of the American Medical Association, they wrote that males aged 12 to 15 experienced 70.7 myocarditis cases per million doses administered, while males aged 16 or 17 experienced 105.8 cases per million doses. However, these researchers at the CDC, they conceded that these figures are likely underreported given the fact that the data that they're pulling from, the VAERS data, is a passive reporting system. And therefore, well, here's specifically what the CDC researchers wrote in this paper, quote, "Therefore, the actual rates of myocarditis per million doses of vaccine are likely higher than estimated." Now, in terms of what the real actual risk percentage might be, well, there was another study published not too long ago over in the New England Journal of Medicine, and those researchers, they were analyzing a surveillance system managed by the Israeli Ministry of Health. And according to their research, they found 18 cases of myocarditis leading to hospitalization following Pfizer vaccination of approximately 731,000 kids aged 12 to 15, some of whom had actually received a second dose. Now, there were some different nuances to that particular data set, but after taking those nuances into account, well, these Israeli researchers wound up pegging the risk of myocarditis among males as 8 cases per 100,000 following the second dose, and among females, they found it to be 0.6 cases per 100,000 second dose recipients. So take that for what it's worth. The reality is that, frankly, we will not have a definitive answer for likely a very long time, maybe even years, as the researchers from all the different countries around the world are analyzing their country's data. Regardless, though, let's now circle back to that study conducted by the CDC. Those researchers, they wrote this as a part of their ultimate conclusion, quote, "Even though almost all individuals with cases of myocarditis were hospitalized and clinically monitored, they typically experienced symptomatic recovery after receiving only pain management. In contrast, typical viral cases of myocarditis can have a more variable clinical course. For example, up to 6% of typical viral myocarditis cases in adolescents require a heart transplant or result in mortality." Meaning that these researchers are finding that post-vaccination myocarditis being experienced by these children is on average much less dangerous than myocarditis that's being caused by the virus itself. But less dangerous does not actually mean that the patient gets off scot-free. That's because myocarditis, as a form of heart inflammation, well, it often leaves people short of breath, with chest pain, as well as with other symptoms such as scarring of the heart. Sometimes it can even lead to death. And according to a survey that was conducted among some of the youth whose conditions were reported to the CDC at least 90 days after they first experienced symptoms, it found that about half were still suffering from at least one symptom, such as chest pain, which is again 90 days after it was first reported. And a second parallel survey was conducted, and it found that about 4 in 10 patients were still on exercise restrictions several months after experiencing the heart inflammation. And so again, in terms of what the real risk is at this moment, it's not known. If you'd like to read any of the research from today's episode, I'll throw it all into the description box below this video for you to check out. And all I ask in return is that as you're making your way down to that research, take a quick detour to smash that like button, as well as, if you haven't already, smash that subscribe button so you can get this kind of honest news content delivered directly into your YouTube feed every single weekday. And now let's shift. Oh, sorry. What's this? It's me. Of course it's Sekur, because we use the Sekur app, which is the sponsor of today's episode, as well as an awesome email and message service provider that actually cares about your privacy. Now listen, it's no big secret that our data is being mined and remined all the time. In fact, there was a recent study that was published in the year 2020, which found that 155 million Americans, likely including you and me, have suffered some form of data breach. And frankly, that's only what's publicly known. However, all those past problems with privacy issues and data mining, well, that can be an issue of the past, because moving forward, you can use the Sekur app, which both your messages, your emails, and your phone calls can remain private. That's because they have their servers and their data centers located in Switzerland instead of in the US or China or Russia. And why does that matter? Because Switzerland has the strictest data privacy laws in the entire world, and they are not subject to the intrusive Cloud Act. Now, what I love the most about the Sekur app is that they don't collect my data, they don't mine my data, they don't mine the data and phone numbers of my friends and family. Everything is private. And best of all, at least in my opinion, this does not work with your big tech email provider just because it is not secure. And so check it out. You can head on over to Sekur.com, and if you use promo code Roman, you can get 25% off. And frankly, their rates are not even that expensive. It only starts with $5 for the messenger and $10 for the email and messenger combo. And best of all, they offer a 7-day free trial. And now, as I mentioned in the beginning of this episode, just today, I published a phenomenal interview between myself and Dr. Richard Urso over on Epoch TV. Here's a trailer.
Now we know it has made significant changes in the pharmacokinetics of this vaccine gene therapy. The pseudouridine is unable to be processed in some ways, and so it's persisting in germinal centers, it's persisting in the body for long, long periods of time. This is why you're seeing a lot of people complain of these long symptoms after the vaccine. It's persistent inflammation, likely from persistent spike protein in the body. So we have treatment regimens we're instituting to try to get rid of that. And I think the persistence of the spike is creating some of that immune system dysregulation that's occurring after people get the vaccine. And we're seeing this spike of, like I said, 40% deaths between 18 to 64, 82% deaths from 25 to 44 in the last quarter. These are things that have to be associated with the vaccination program.
If you want to check out that phenomenal interview, as well as a plethora of other great content over on Epoch TV, I'll throw a link to it. It'll be right there at the very top of the description box. I hope you click on it. I hope you check it out. I hope you subscribe. And I hope that you not only join us on this journey of exploring this world through honest journalism that's based in truth and tradition, but also know that by subscribing, you are supporting the journalism that we do here at the Epoch Times so that we can continue to bring the truth to the world. Again, that link will be down in the description box below. And then until next time, I'm your host, Roman from the Epoch Times. Stay informed and stay free.